righty. So again, my name is NaQuanda Jordan. I work for the New York State Office of Children and Family Services as a Child Abuse Prevention Specialist 2. I work in our Child Welfare and Community Services Division. My goal was to take a look at how can we address disparities in child welfare mandated reporting. So here, if you take a look, what I have outlined here is a map of the New York State Office of Children and Family Services that I feel is very essential. Sometimes when we're talking about child welfare oversight, specifically at the state level, it can get somewhat confusing. So I wanted to share this map of New York State to show you what it looks like, specifically what our local districts are, where they are specifically in the state, and how we cover it regionally. In New York State, child welfare is administered by local districts with state oversight. OCFS is responsible for oversight of 58 local departments of social services, the St. Regis Mohawk Tribe, and the voluntary agencies that contract with social services to provide child welfare services. As I stated, we're divided into 6 state regional offices. I work in Region 2, which is responsible for covering 9 counties. I'm also currently the OCFS lead for Monroe County. So James Baldwin once said, anyone who has struggled with poverty knows how extremely expensive it is to be poor. This quote resonates with me. Poverty has cost my ancestors and current family members separation, grief, loss, incarceration, anxiety, fear, and hopelessness, just to name a few. My family migrated from the rural South in the 60s during the Great Migration. My grandfather was not allowed in the home due to public welfare requirements at the time. If anyone is familiar with child welfare history, you may be familiar with the man in the house rule. My Southern grandmother raised 14 children, 9 boys and 5 girls, all while living in poverty. I'm the daughter of teenage parents. My mother was 17 and my father was 18 when I was born. By the age of 5, my father was sentenced to an 18-year prison sentence. My mother was a single parent of 3 children by the time she was 21. But the difference for me was I had teachers, family, and community members that supported us, and they believed in us. They believed in my mother. Yes, she struggled at times. However, a lot of her struggles were due to childhood trauma that she suffered, as well as the poverty that she lived in, not abuse. At the time, the community was able to rally around my family and I, and she wasn't reported to CPS for slight infractions. They asked how they could help. What could they do to assist us and to help us move forward? Today, I'm a first-generation master's level college graduate. I am my ancestors' wildest dreams. I'm so thankful to be here, and I feel like I'm here to represent the Black and Brown children from the inner cities across the United States, specifically those that are represented in the 14621 area code of Rochester, New York. So what did child welfare policy look like at the beginning of the 20th century? And I do have a lot of history within my PowerPoint because I think it's very important. We have to focus on the historical events that shaped child welfare as to what we know child welfare to be today. In 1909, the White House Conference focused on the care of dependent children. During that time, the conference established the Children's Bureau as we know it today. In 1935, the Mother's Pension was established. That's an extension of the aid for dependent children. At this time, white widows were the primary beneficiaries of this assistance. It was state determined, therefore there were disparities. Blacks were barred from participation due to separate and unequal laws, sometimes better known as Jim Crow laws. In 1960, Louisiana expelled 23,000 children from their welfare programs due to being born out of wedlock and considered to be illegitimate. In 1961, around that time, the federal government ruled that it was unconstitutional. They declared that you cannot deny income assistance on the basis of a home being unsuitable or of a child being determined to be illegitimate. Several laws that passed following the Louisiana incident in the institution of the Fleming Rule laid the foundation for punitive child welfare policies that disproportionately harm children and families of colors today. So history of mandated reporting. You have to know your history. To do this work, we must have courageous conversations and acknowledge the past and current policies and practices within our system. People of color have suffered for years due to historical trauma. It's our job as child welfare leaders and practitioners to never forget and to strive to continuously improve their experiences within the child welfare system. We must be aware of their cultural histories at the individual, family, and community level. From exclusion to overrepresentation, how do we get to where we are? Prior to the 1960s, children of color were virtually excluded from the child welfare system. Think back to the 1960s. What do you know about what was going on in our country? If you're not completely familiar, I'll enlighten you. Jim Crow, from 1870 to about 1964, it was alive and well. Jim Crow were laws, state and local laws that enforced racial segregation in the Southern United States mainly. During this same time, I spoke earlier about the Great Migration. It occurred from about 1916 through the 1970s, where 6 million African Americans migrated to the urban Northeast, the Midwest, and the West from the rural South. They migrated to escape brutal treatment and disregard of Blacks in the South. These were the descendants of Black people that were enslaved in this country in the rural South and all over the US, depending on the time frames. They were running to safety, freedom, better housing, job opportunities, and quality of life. They were running from racial segregation and unequal access. And if you take a look at about the 1970s, CAPTA, or the Child Abuse Prevention Treatment Act, was enacted in 1974. This required every state to have provisions or procedures requiring certain individuals or professionals to report known or suspected instances of child abuse. So we went from segregation and potentially being unnoticed and excluded in the rural South to, during some of this migration, they're becoming more visible, people of color, specifically African Americans. So exclusion to overrepresentation of children of color, it can be linked to CAPTA, the war on drugs, and ASFA. Child welfare history is linked to race, class, drugs, and reproduction. Today, national research shows us that disparities exist throughout the child welfare system, not only at one point, but throughout it. Black children and families have been most significantly impacted by disproportionality in this country. So the current view, fast forward to 2021, almost about 50 years later from some of those events that occurred, families of color are more likely to be reported for abuse and neglect due to distribution of wealth, opportunities, and privileges within our society. Over the past decade, there has been an increased focus on how families of color experience the child welfare system, which is important. However, there has been minimal focus on how these families come to the attention of child welfare. To achieve racial equity and social justice within the child welfare system, we must address the how, we must address the why. Children of color are more likely to be placed in foster care, and they generally experience slower achievement to permanency goals, as well as children of color involved in the system also tend to experience lower educational outcomes, higher rates of delinquency, incarceration, homelessness, mental health, and substance abuse issues. So mandated reporting has continuously expanded. Over the years, mandated reporting at the federal and state level has continued to expand. We've seen, although through the expansion, macro level barriers that impact Black and Brown communities more severely have not been consistently or adequately addressed. The expansion of mandated reporting without inclusion of implicit bias or racial equity or cultural competency training may have had a direct impact on the disparities that we see today, specifically in child welfare reporting and registering of CPS investigations. According to national research, and this is the important part, high child poverty rates are related to increased CPS costs, not actual child abuse or neglect. In New York and across the US, predominantly African American and Latino neighborhoods have disproportionately high rates of reports of abuse and neglect reported to CPS. In these same communities and involving these same families, they are also more likely to experience institutional and systemic racism, poverty, implicit bias, inequality, redlining, food insecurity, housing instability, access to quality healthcare and childcare, unequal access to higher education, and disparate police control and contact, which all are social determinants of health. Police contact and CPS surveillance are not random. In the contact, is not equitably distributed across populations. Therefore, we have seen a negative impact regarding racial inequalities and child welfare outcome. Policing and CPS surveillance affect certain families and cause unnecessary child protection interventions in which some children may also go unnoticed. We have children that are being surveillanced at high rates and some not so much. And again, some of this is due to issues within our system regarding equity. Therefore, sometimes children from affluent and/or predominantly white communities could be suffering from abuse or neglect. But again, some go unnoticed, which has an impact on the underrepresentation that we see amongst certain populations in child welfare. So if you can take a look at this chart here, this is specifically outline what disparity rates look like in New York State at the end of 2019. We track a lot of data at the state level and county level because we know that data tells a story. It tells one side of the story, but it's very important to know, what your numbers are and specifically how certain children and families are showing up in your data. These rates here represent children, families, and communities. They're not just numbers. Child welfare data is more than numbers. It's about real people. And so if you take a look here, again, it's the 2019 statewide child welfare disparity rate and category by race and ethnicity. This is the New York State DMR data. We have Black, Hispanic, Native American, and Alaskan children represented on this chart. If you take a look, we're starting at our front door. Who are the children that are showing up in CPS reports? Who are the children that are being indicated? They're involved in indicated CPS reports. Who are the children who are actually placed in foster care? And then based on this data, who are the children that were in foster care at the end of December 2019, actually on December 31st of 2019. So if you take a look at the chart, there's some trends here. We see where Black children, as far as the disparity rates, it goes from moderate all the way up to extreme. So Black children are more likely to be involved in CPS reports. They're more likely to have those same CPS reports indicated involving them. They're more likely to be placed in foster care, and they're more likely to linger on foster care as well, according to the data, specifically in New York. Hispanic children, you see there's a disparity is there as well. They go from low to moderate. Native American, Alaskan children as well. They start out low. The disparity rate is moderate regarding placement in foster care, and then it goes down to a lower disparity rate for children in foster care. But this is really important data. I know that in our state, we focus on this data along with a lot of other data points, but this is data that I use to guide my work in this project. So exploring the why, that's what I set out to do. Why have we shifted from excluding families of color, like I referenced earlier, to the fact that at this point, the child welfare system is over-reporting, registering, investigating, indicating, removing, and placing children of color in foster care at disproportionate rates, Is the shift from exclusion to disproportionate Black, Indigenous, and people of color representation, or some may refer to as DMR, I'm referring to it as D-BIPOC, directly linked to federal, state, and local child welfare policies and practices. So CAPTA came into law over 45 years ago. It tended to address the fact that child abuse, as we all know it, and neglect, it cuts across all lines of race and class. However, it did not outline the fact that race and poverty are not synonymous, which means just because you're a person of color and poor, it does not mean, or it's not an indicator that you are more likely to abuse your child. Race should not determine child welfare outcomes, but you know what? In our country, it currently does. We're aware of it and we know the data, and race does impact the child welfare outcome for specific families and children. We know it. So to address the issue in New York State, we've engaged in several strategies, which I would like to talk about some of those. In 2020, blind removals were implemented in New York State. At this time, we're focusing on addressing all disparities in child welfare. The chart here really outlines where we are, how we've engaged in our journey to race equity, social justice, and inclusion. How are we planning to achieve that? So I have a chart here that outlines some of the strategies, some of our administrative directives, policy, different things that we plan to do in New York. In 2020, the blind removals were implemented. In 2021, the Adverse Childhood Experiences Bill was passed. And in 22, we're looking forward to the future in regards to continuing to work on reforming our state central register as far as at the legislation level. So the blind removal policy and the ACEs bill were both implemented in New York because New York is committed to creating a more just and equitable child welfare system by addressing the root causes. OCFS has continuously used a race equity lens when examining and evaluating the effectiveness of policies and practices. So I'm very familiar with the work. Blind removals were designed to limit bias in the decision-making process during the CPS removal. The ACEs bill was enacted to require OCFS to revise our mandated reported training, which will include implicit bias regarding the decision-making that mandated reporters engage in prior to hotlining to our state central register. In 2020, the SCR reform will also focus on addressing implicit bias that may be related to decisions that are made at the SCR level. The theme across all three of these areas specifically lies around decision-making, which can be impacted by conscious and unconscious bias. So my PICO, if the New York statewide mandated reporter work group members are provided with information, resources, and guidance to prepare them and support their task of revising the mandated reporter curriculum, will it result in a curriculum that is culturally responsive and decrease the disproportionate reporting of children of color, specifically Black children, to the New York State Central Register? So I engaged in a couple of different methods to address my PICO and to explore the why. I reviewed a lot of literature. I've also reviewed data from focus groups with affected families. In addition to that, I've gathered and analyzed New York State Central Register data and trends. I gathered the data at the state level, and then I wanted to take a look at Monroe County as well. A lot of my look into Monroe County was the fact that it's a county that's located in my region, is one of the larger counties in New York State, so it drives a lot of our outcomes total as a state. In addition to that, Monroe County is very committed to the work as well. And I've also convened and worked with a mandated reporter training work group statewide. The mandated reporter training work group was established at the administrative level within OCFS and the Child Welfare and Community Services Division. I had the opportunity to co-lead that work with an OCFS attorney. In addition to that, there are work group members from all over the state. Specifically, there are individuals that are partnering with us for one of our sister state agencies in education. Within OCFS, we have members from our policy unit, other areas within our child welfare or program side of the house, as well as individuals from our Bureau of Training and Legal. So in addition to that, during the work group, we conducted knowledge building sessions with the work group to better inform them of child welfare disparities in New York State. A lot of individuals that are at the table on this work group, they're familiar with the data, they're familiar with the disparities, just again, because New York has focused on a lot of this work. We reviewed the ACEs bill. In addition to that, we reviewed the current mandated reporter training and brainstorm around how to engage mandated reporters. We wanted to do that specifically to find out, what their thought was in regards to where we are currently in regards to disparity rates. I'm always interested in engaging externally to make certain that we're hearing voices from the field and from our community, because it's essential to guide our work. In addition to that, and engaging in the work, I also developed a survey. The survey focused on engaging social service personnel because through the data pool, we were able to find out that in New York State, social service personnel are the #1 reporter sources for registered intakes. And what that means is these are the reports that are actually registered for investigation in New York State. It's not the cause to the SCR, but it's the reports that are actually registered. So we took a look at the data statewide and in Monroe County. So overall, the work group, if I can just back up a minute, will be charged with redesigning the New York State mandated reporters training to be in compliance with the ACEs bill. And the goal is to focus on a training that will enhance mandated reporters' ability to think more empathetically and critically. The training will also include components that address and interrupt patterns of implicit bias in decision-making, which has an impact on disproportionate child welfare reporting. So this graph here is a quick visual. It represents New York State and Monroe County registered reports by mandate or type. And I thought that was very important because, again, I wanted to take a look at where the reports were specifically coming from. According to the data, social services personnel were the #1 reporter source in 2019 and in 2020, and statewide and in Monroe County. Law enforcement, education, and parents, specifically in Monroe County, not statewide, but they also make up a portion of the cause. We did see that difference, whereas in Monroe County, we're seeing where parents are calling in reports as well. So again, I don't have any specific information because obviously mandated reporters and individuals who wish and sources are anonymous in New York State. However, this is just general information in regards to who these individuals specifically are as far as what profession they fall into. So again, if you take a look at the trends, we see here where social service personnel make up the bulk of the calls. So this graph here shows mandated reports by top 3 reporter types by race in New York. Statewide in 2020, the top reporter source for social services, law enforcement, and education personnel. Statewide in 2019, the top reporter sources were social services, education, law enforcement. These groups of mandated reporters accounted for over half of the registered reports regarding Black and Latino children in 2020 and 2019. This graph here shows mandated reports by the top 3 reporter types by race in Monroe County. So in Monroe County in 2020, the top reporter sources were, again, social services, parents, and law enforcement. In 2019, again, top reporter sources were social services personnel, education personnel, and parents. In 2020 and in 2019, mandated reporters accounted for the majority of CPS reports regarding Black and Latino children here as well. One of the differences, again, that we did see is that parents are calling in reports that are registered as well. And so I don't want anyone to hear that the issue is the fact that mandated reporters are reporting suspected cases of abuse or neglect as per capita. They're doing what they are supposed to do as per the law. The issue is that I found based on the data, the literature, is that mandated reporters may be calling in these reports disproportionately regarding children of color. And subsequently, according to the data, there are disparities. We see them. Families of color are more likely to be involved in SCR intakes in New York. So this is a map of Monroe County, which depicts case addresses of the children and families involved in the 2020 registered SCR reports. And when I say case addresses, we don't have that specific information. We just have the zip code, which is important because zip codes tell us who we're dealing with, who are these individuals, who are these families, who are the communities. What are the communities, excuse me. So along with the reporter source, it outlines that here for us. We can see social services, parents, and law enforcement were the top reporter sources for 2020. And we can see here by zip code. One of the most important things to see here is that the majority of the CPS reports that are called into the SCR in this county, which is Monroe, and actually register are from an inner city zip code, which is 14621, which is where I was born and raised. Which is referred to as the crescent, which is also referred to at times as the fatal crescent or the crescent of poverty. And that's because the neighborhood is plagued with homicides, gang violence, drug activity, other forms of crime, and poverty. It's also heavily patrolled by law enforcement, and it has a large presence related to child protective services as well. These maps can be recreated. And I think it's important because it provides a visual and allows you to really hone in on where your cases are coming from and specifically also maybe who the mandated reporters are. And I do believe that if we did recreate these maps across the state, we're probably going to see similar trends throughout specific zip codes that are populated with impoverished Black and or Latino families. The data tells us that. So I think that it's very important. Someone may be sitting there saying, okay, so, why is this important? The interesting piece here is that the majority of CPS investigations are unsubstantiated. They're not founded. The majority of allegations are unsubstantiated and the reports are being unfounded at a higher rate. In 2020, 66% of all CPS investigations statewide and 74% of all CPS investigations in Monroe County were unfounded. It means in our state that we did not have credible evidence to substantiate the allegation. Of the indicated investigations statewide, about 57 were substantiated due to allegations that involve neglect only. I think that's very essential because sometimes there is a thought that we need to focus on, making certain that all kids are safe or that, all kids aren't safe. Sometimes it's sensationalized. Mandated reporting is not the ultimate answer because there is little to no evidence to prove that mandated reporting actually decreases child abuse. There are children that require protective services. I don't want anyone to hear that. I don't think that's the case. There definitely are, but the actual substantiated cases have remained low for years nationally. Referrals have continuously increased across our country. Every year they increase. However, actual substantiated cases have remained low. The number of referrals are not the same as the number of cases of actual child abuse or significant neglect. To further my work, one of the things that we did do is, I wanted, again, to engage social service personnel. We did create a survey in which I want to go over here briefly. I talked about it before, but I had the opportunity to work with Monroe County. The Commissioner, Thalia Wright, graciously partnered with me. She and her staff partner around this work because, again, they're committed to the work. The survey was voluntary. It was anonymous. The survey was specifically piloted in Monroe County. It was deployed to all child welfare staff in Monroe County. The response rate was about 85. And the goal was just to glean an initial impression regarding their level of knowledge and level of agreement with certain topics related to disparities in child welfare. The survey results, again, 85 people engaged in the survey. One thing that really jumped out to me are the demographics, which you can see here. I'm not going to read them specifically to you, but the response rate, about 80% of the personnel identified as white, 16 as African-American. And if you go down here, you'll see the majority of staff that engaged in the survey were 89% identified as female. These demographics are mirrored across the state and federal levels. The child welfare field needs improvement regarding diversity in personnel, especially at the administrative level. The field needs to develop strategies to move towards recruiting, retaining, and promoting diverse child welfare staff and leaders that represent and reflect the children and families that we serve. I'm going to also go through some of the results here. I wanted to find out this information to see if this was something where we could potentially glean an impression. We need to hear from staff in the field. We also, always want to hear from parents as well. But I think in regards to this work, hearing from staff that are actually responsible for the day-to-day work, was pretty eye-opening for me. I did learn that Monroe County staff, about 81% of them, believe that they were either very knowledgeable or knowledgeable about child welfare disparities. We asked them to rate themselves, in which they did, in which they're saying that they believe that they're knowledgeable about the disparities. They also feel knowledgeable or very knowledgeable about the social issues that impact certain children from certain zip codes that are more likely to be reported to the SCR, and that was about 87%. 85% of staff felt very knowledgeable or knowledgeable about the extent to which children of color are more likely to be placed in foster care. And as it relates to the achievement of permanency, most staff were also very knowledgeable or knowledgeable. About 30% of staff felt that they were only somewhat or not knowledgeable at all about that topic. Most staff were aware of mandated reporter trends and how implicit bias can impact decision-making. We also asked questions around, whether or not they felt that the mandated reporter training should include specific topics related to cultural competency and or implicit bias, because again, we are charged with updating our mandated reporter training in New York State. But to hear from the field, I thought was just, something that, I just can't fully measure the value of that. It's very important to hear their voices, and they agreed at about 84% regarding cultural competency and 96% regarding implicit bias. They believe that it will be beneficial to update the training. About 90% of staff strongly agreed that federal policies actually impact child welfare outcomes. 60% of staff strongly agreed that they may have an impact on recurrence rates. Most staff were neutral or disagreed strongly regarding what the data tells us. The data tells us that social service personnel are more likely to report families to the SCR when compared to, for example, education personnel, but staff weren't fully aware of that. Only about 20% of staff agreed with this. So only about 30% of staff strongly agreed that social service personnel were more likely to report families when compared to law enforcement. About 63% of staff disagreed or strongly agreed that law enforcement were more likely to report families to the SCR when compared to education personnel. About 81% of staff strongly agreed that educational personnel were more likely to report families to the SCR. So these findings were very interesting in regards to, as we take a look at, what the data tell us. The child welfare staff in Monroe County are very knowledgeable about a lot of these topics. 64% of Monroe County staff believe that the county was actively working on decreasing child welfare disparities. Some were neutral, and they believe that at the state level, about 44% of staff believe that we were actively working on decreasing child welfare disparities and increasing equity for all. So I thought that feedback was very helpful as we move forward with some of this work. So some next steps here. So next steps are to identify some resources to address the underlying issues and root cause related to my project. In addition to that, conducting an analysis system-wide regarding root causes and updating and revising the mandated reporter training and potentially exploring what some warm line CPS alternatives may look like, SCR alternatives, because other states are doing it. How can we, or trying to do it, how can we do it in New York State? So some expected outcomes, the journey continues. Shifting practice and the mindsets across the state is hopefully my goal and eventually across the country. So I would like to reduce implicit bias in decision-making. Also decrease disproportionate SCR reporting, improve recurrence statewide, and advance social justice and improve equity. At the federal level, some of my recommendations are updating CAPTA, updating the Child Abuse and Prevention Treatment Act to require that every state and territory revise mandated reporter training. Some states are forward and are doing it, but it's not being done across the country, and I think it's essential. Look into working with states and territories to consider a fair preponderance of evidence as the level of evidence required to substantiate CPS allegations. Assist all states and territories with developing warm lines as a diversion to CPS. And last but not least, with something that I think is very important, is to encourage the discontinuation, of the use of the term disproportionate minority representation. Replace it with disproportionate BIPOC representation. When you talk about and use the word minority, some may feel that is racialized language. The word minority emphasizes quantity instead of quality. And people of color are more than numbers. We deserve to be fully acknowledged. And BIPOC, or Black, Indigenous, people of color, that's a more acceptable term referring to this population of people. So lastly, and I'll go through this quick because I've gone over my time a bit because I tend to do that, but let me hurry up. So MPLD, I can't say enough how it's really impacted me. The fact that I've had the opportunity to really think beyond my locus of control was very important to me because sometimes, you don't feel big enough to do those things. So that has helped me immensely. It has enhanced my focus on data, as I stated, working for the state. It's something that we've done. We've definitely dabbled in the data, but I've gotten a little more comfortable with it because, again, I'm a social worker to the core. I failed math in high school, I'll be honest. And, I'm not a full, person that was always about the data at first, but now I've grown to love it, to understand it, to know it, to want to use it, to always ask about it first. So I appreciate that. I think that MPLD has had a positive impact on my imposter syndrome because, I'll be honest that I do definitely carry it around. Many times I didn't feel comfortable at the table because, people didn't always look like me. And sometimes when we were discussing specific children and families, I could relate. It's almost like you're talking about me. I'm that child. My family, that's my family. So it was very just powerful for me to feel like, own your story, don't be embarrassed, talk about your struggles. I didn't feel the need to code switch amongst these great individuals. It was the first time, in my career over 15 years that I've had the opportunity to work with individuals that look like me and to be a part of the majority, I would say. Even though I don't like those terms, majority, minority, but at this time I was able to be a part of the majority. The networking opportunities, I can't speak anymore about those. They've been great. And I would say just MPLD has helped me enhance my knowledge, my skills, and my passion. Especially, it was on time because it was a time where I was really questioning the work that I do, whether or not I was making a difference in the lives of children, families, and communities. And, MPLD has helped me reignite my passion. And, it's lit from here on out. I'm just not going to stop. I'm forever thankful to Thalia Wright, the commissioner of Monroe County Department of Human Services, for referring me to this MPLD program and always supporting and believing in me. My leadership at OCFS, Chris Bruno, Barbara Green Flood, thank you both for supporting me in this work. And when I was asking about, engaging in this program, I got a absolutely you can. So thank you for that. Dr. Sherilyn for understanding my sass and challenging me to think bigger every step of the way. And Arlene, last but not least, for guiding me, always being patient and encouraging me to stand in my truth and to share my story, because I didn't know until yesterday that I actually was going to share in that way. So thank you for allowing me, helping me to be vulnerable. I appreciate that.